getting the vaccines. And okay, so there are people who ask us, okay, so does the vaccine give us COVID-19? I really feel sick from the vaccine. No, the vaccine cannot give us COVID-19. It's a dead particle. It's just the versions of the vaccine on the market right now are the mRNA and the Johnson & Johnson. Those are all dead. So the COVID vaccine cannot give us COVID-19. Now, can we get tested positive for COVID if we receive the vaccines? The answer is no. Your PCR or even your antigen, any of the swabs that you receive will not test positive. Next slide. So again, do the vaccines work? The quick answer is yes, absolutely. Right now, the current vaccines that are available in the US have been shown highly effective of preventing COVID-19 disease. I know in the beginning when we had the studies, Moderna and Pfizer both have very, very high efficacy to COVID-19. Now with the new Delta variant, we know that on the market and in real life, the vaccines are still highly effective. Pfizer, the percentage about in the 78%, and Moderna is about 85%. So we look for any percentage that is above 75% protective. So these vaccines are still highly effective for our current variants. Next slide. So I talked about the new variant, right? So everyone knows by now that there's a new Delta variant. Extremely contagious. Some people have, some paper have described that it's as contagious as measles. So basically, if you're in a room, a person without a mask and has COVID, you can contract COVID, and it's that easy. So again, we want to prevent disease. We don't want people to get sick. So vaccination is a best tool to stop this new variant and stop people from getting sick. So protection. We want people to not get sick. Our main goal is to prevent hospitalization and prevent you from getting sick. Next page, next slide. I think this is almost the elephant in the room, right? I think a lot of people don't want to get the vaccine. Some people are concerned about the safety of the vaccine because it's still quote unquote new on the market. But bear in mind, there's many studies that have been done, and the initial studies were done on tens of thousands of patients. And right now, there's been millions and billions of people not just in the US, but in the worldwide who have received these vaccines. So it has been demonstrated that the vaccines are extremely safe. I'm going to give you more numbers on the next slide. At the minimum now, 170 million people are fully vaccinated in the US. So look at this number, right? 0.0065%, this is less than 0.1% of patients who are fully vaccinated may have breakthrough infections, meaning that they're fully vaccinated but still caught COVID. And these patients, only 0.01%, less than 0.01% of patients require hospitalization and death. I think sometimes we also forget about the flip side of the story, which is more than 99% of the patients, actually 99.9% of the patients who are fully vaccinated, either they don't get sick from COVID, or even if they get sick, less than 1% of these patients will get hospitalized, and even less of those patients may die. So we know from these numbers and stats that the vaccine is extremely safe and extremely effective. Next slide. So these are real world experience. And I mean, all of our doctors on the panel will attest to you these numbers, because I see COVID every day, right? So unvaccinated people are the ones that I see mostly in the hospital. 96% of patients who are admitted to the hospital in New York City alone from January 17th through August 17th were unvaccinated. So this is huge. Only very, very small amount of patients who are admitted to the hospital for COVID are vaccinated. And so they account for such a high level of hospitalizations. And look, people who don't, I always tell my patients, people who have COVID and usually don't make it out of the hospital are the ones who are unvaccinated. I actually, in my personal experience, all of my vaccinated patients who unfortunately may get admitted to the hospital, as soon as they get their medications and the treatment, they usually, all of them actually, not usually, all of them have made it out of the hospital. All of the patients that did not make it are the ones who are unvaccinated. Next slide. So this is a really big slide. I think we have to be ingrained with these numbers and remember these numbers. Unvaccinated people are 5 times more than have a higher chance of getting infected with COVID than fully vaccinated people. And 29 times more chances to be hospitalized than fully vaccinated people. So if you're unvaccinated, your chances of getting sick from COVID is 5 times more than your peers who are vaccinated. And if, God forbid, you got COVID and unvaccinated, your chances of being hospitalized is almost 30% than your peers who are vaccinated. Next slide. So I want to go over very quickly because I think my colleagues will also speak about these. Can the vaccine cause infertility? This is such a big question always. And the answer is absolutely not. There's no evidence, absolutely no evidence that this is true. In fact, there's been study that shows the fertility rate in the unvaccinated versus vaccinated females is the same. Okay, so that's your basic answer, quick answer. And if I'm pregnant or if a patient is pregnant, breastfeeding, or planning to become pregnant, can they get the vaccine? The answer is yes, and please do, because we know that the antibody from the vaccine actually can pass through the breast milk. And there has been newborn babies who are born to vaccinated moms, they actually carry the antibodies from the vaccine. So these are huge because right now, babies are not eligible for the vaccine. So you will create this passive immunity to your child. And the big question is, if I have so many different kinds of allergy, is it okay to get the vaccine? So the answer is, of course. I have had many patients who have a whole big list of allergies, 15 to 20 allergies, and including, pneumonia vaccine allergy or influenza allergies, influenza vaccine allergies. Can they get this vaccine? The answer is yes, because the vaccine does not contain egg, gluten, latex, or any preservatives. And so only people who've had an allergic reaction to the first COVID vaccine, or if they have allergic reaction to this particle called or component called polyethylene glycol, then it's absolutely okay to get the vaccine. Okay, so can the vaccine make me sick? Sure, any vaccine can make us sick, right? But I think sick, we mean that, okay, you may have a little bit of redness and tenderness, pain, and at the injection site. You may have a low grade temperature, you may feel tired, or you may have a little bit of headache. For 1 to 2 days, it's not bad. And it's so much better than getting sick from the vaccine than getting sick from the actual COVID disease. Okay. I am going to leave this time to my next colleague. Thank you so much.
Arlene, I believe you're still on mute.
There you go. We've done so many, Zoom meetings, and when it's time to unmute, it's like we forget that we have to unmute. I appreciate you guys reminding me that I have to unmute myself. Thank you, Dr. Wong. It's very important that people understand, what it is that you guys are looking at, what comes through the doors that you have to deal with. So it's for me, I know it all too well. I'm not a doctor, I'm not a nurse, but I do work in a healthcare facility. So throughout COVID, I saw the effects of COVID on the patients, the hospital, the staff, and also family members. So I think it's very, very important that people understand that the information that you guys are giving is, is not just beneficial to that one person listening to it, but those that we can carry the information to. And I think that, part of our message tonight is that whoever is listening, please take these messages to the person that's next to you when you're, at home having dinner, or you're on the phone with someone. Make sure that they understand that if they're not vaccinated, it is okay to do it. If they have questions, ask your questions. Tell the doctor you have questions, you have concerns. Let the doctors know that you want to be informed, you want to be educated before you take the step, but take that step nonetheless. Right after you are informed and educated, take that step. It is very important. And when I get through with all our doctors, I will say why I feel that is totally important. So because I do have my own message to put out there. So without further ado, I also have Dr. Julia, and please correct me. Yaziri? Come on. Yazara. Okay, see, I'll get it. Before the night is out, I will get it. It's sometimes we don't, pay attention, but nonetheless, Dr. Oh, here I go again. Iyashara is the executive director of the Dalio Center for Health Justice at New York-Presbyterian. In this role, she leads the center's efforts to address longstanding health disparities due to race, socioeconomic differences. Woo, I'm so excited. Limited access to care and other complex factors that impact the well-being of our communities disproportionately. She is previously the Associate Chief Medical Officer for Service Lines and the Co-Director of the Care Team Office. She was also Director of the Leadership Education and Development for Physicians Academy, Associate Designated Institutional Office Official for Graduate Medical Education at New York-Presbyterian Hospital, and the Associate Program Director of the Columbia Internal Medicine Residency Training Program. An Associate Professor of Medicine at Columbia University Irving Medical Center. She continues to see patients as an internist in the section for hospital medicine. Well, that is a lot and very impressive. Please, doctor.
Thank you so much. So I want to, add on to what Dr. Wong really started to talk about around the vaccines. But before I tell my own personal story or talk to you a little bit about why I do this work to educate people around vaccines, I think it's really important just to set some ground rules, particularly because we're trying to really not just educate people, but encourage vaccination. And so I think to be able to do that effectively, you have to really understand where people are starting from. So there are a lot of historical reasons why people feel that there is distrust and mistrust with the medical community. You have personal experiences which may make you uncomfortable with vaccination or with a vaccine that for some have thought that is come to market very quickly. So I think understanding where someone is coming from and being supportive in the conversation is the best that we can do. And we also know that when we're trying to encourage people to be vaccinated, They trust doctors, yes. They trust nurses, they trust healthcare professionals, but they also trust their friends and their family and their peers and their colleagues. And so the more people that we get carrying this message about the safety of the vaccines, the necessity of vaccines, the better. Because I can go on as many talks as I want, but ultimately it's probably not me that's going to make the difference. It's your next door neighbor. It's your best friend. It's your sister. It's someone who you trust, who you love, who has encouraged you to be vaccinated. So I really want to say, for those of you that are listening that have been vaccinated, go talk to your friends and your family, explain to them why you made this decision. You may be the one who helps people to get vaccinated, and your voice may carry much further than mine. So now that I've said that, I do still see patients. I'm an internal medicine physician, and I saw patients through the first wave of COVID into the second wave of COVID. I do have an administrative role now in the hospital. My goal with the Dalio Center is that we help to identify and eliminate health disparity. So what bigger disparity have we seen than after the COVID pandemic? We have seen the loss of many Black and brown lives across the country, and we have seen the loss of life across the world. We are now over 700,000 people that have died because of this pandemic. So what better work could I do to help understand and eliminate health disparity than to encourage vaccination? So both in my professional life, in my administrative role in the Dalio Center, this is incredibly important to me to educate people around the safety and the efficacy of these vaccines. But then also personally, as I said, I saw patients through the first wave of COVID, the second wave of COVID. I saw people die in front of me. I held hands as people lost their lives. I held phones because people couldn't talk to their loved ones when they were when they had just moments to live. These are experiences that many of the physicians on this call will talk about today, but many of the experiences that we will have with us for the rest of our lives. These are things we cannot unsee. They're experiences that will live with us forever. And it is one of the reasons why we are so passionate about vaccination. It's one of the reasons why I have done probably over 60 vaccine talks myself to encourage people to be vaccinated. And it's the main reason why when I was vaccinated myself in December, I shed a number of tears. They said, and my face is around NewYork-Presbyterian quite frequently. And one of the big questions they asked me was, could they post a picture of me being vaccinated? Could I use that? And I said, well, I didn't take a photo because I was crying. And it's not painful. I'm actually going in for my booster shot tomorrow. I'm not worried about it. It's not a painful injection at all. I was crying because I was so relieved that not only for my own personal safety, I felt like I had protection against an incredibly deadly virus, but also that we had now protection for vulnerable people, for everyone in the country, that we could see that our kids would be able to live full and happy lives, that we could see grandparents, throughout the rest of their lives live happy and healthy lives. And so I think for us, it was a tremendous relief that we had these vaccines. And I ran. So I was vaccinated in December of last year. I had my second shot in January. And because I received Pfizer and I am a healthcare worker, I will receive my booster shot tomorrow. These vaccines save lives. If you looked at there was an editorial just, I think, yesterday that predicted in New York alone, we would have had over 150 to maybe 200,000 more deaths without the vaccines. These are important, they are pivotal to the success of all of us. So it's one of the reasons why I'm here. I share my story, I share about the work that I do, and then I'll continue to be available to answer questions, but most importantly, to support people in making the decision. What I would love is that for everyone to be able to sit down in the seat and be vaccinated and feel that sense of relief and joy and happiness and feeling like, oh my gosh, we are able to save each other. That's what I want for all of you. So with that, I know Dr. Wong answered a lot of the technical questions. I'm sure many are yet to come. We have definitely, I know with Dr. Saleh and Dr. B, you guys have any other questions, they will answer them as well. If there are questions in Q&A or the chat, we're happy to answer them. So I'm going to hand it off to my colleague.
Thank you, doctor. Like I said before, very powerful words and, a lot of wisdom that's coming through our screens. And I hope that everyone is appreciative of your time, because I know that you guys are busy and, it's your time is seriously, well appreciated. Your efforts and everything that you do every day, day in and day out. So I really thank you so much. We also have Dr. Anthony Saleh. Did I say that right?
Perfect.
Great. And we also have Dr. Vivian Bia. Correct me, please. Correct me. So we have Dr. Saleh is the pulmonary critical care specialist who has been affiliated with Brooklyn Methodist Hospital for many years and is the program director for the Pulmonary Critical Care Medicine Training Program. So Dr. Saleh, you want to take over and tell us a little bit more of what you do, how important it has been at your end to have this type of specialty.
Good evening. Thank you, Eleni, and thank you to my colleagues prior to me for speaking so eloquently. It's going to be very hard for me to match that, but I will. So I think a really important thing to understand before we talk about the vaccine is just to talk about COVID, the disease, the actual disease, COVID-19. So way back last March of 2020, when the world really was very different than it is today, we started getting some cases of people who had this cough. And what we found is within a couple of days and sometimes a couple of hours, their oxygen levels would plummet. And from March of 2020, probably through June, July of 2020, the amount of devastation, the amount of death and despair that we saw here was just astronomical. Now, let me give you all some numbers. Here at our hospital at NewYork-Presbyterian, Brooklyn Methodist, we usually have about 20, 25, maybe in a busy day, 30 patients on a ventilator. In April of 2020, we had 140 to 150 patients on a ventilator, and everyone was COVID. We had 2 refrigerator trucks outside filled with bodies of patients dying every day. And this was in spite of all of our best efforts. And back then, we didn't have some of the treatment we have now, like remdesivir or even steroids. And it was just this death and destruction that was overwhelming. So I think when you hear many of us, physicians, nurses, therapists, who have this missionary zeal about the vaccine, that missionary zeal comes from a place of knowing the kind of destruction that this virus has caused, the true devastation. And let me give you some numbers. In April of 2020, we were losing, just in New York City, up to 800 patients a day from COVID, every single day. Now, we love New York. I'm a New Yorker, as you could tell by my thick Brooklyn accent, and we certainly are the capital of finance and fashion and theater and restaurants. But because of how tight our living conditions are, unfortunately, we became the capital of COVID. And that is why many of us have this cataclysmic almost enthusiasm to make sure that our patients get vaccinated. So with that history, I just want to follow up a little bit on some of the safety of the vaccine, because that's something, excuse me, that we hear again and again and again. Well, as of today, in the world, there have been 6.4 billion, I'll repeat that number, billion with a B, doses of this vaccine given in the world. 6.4 billion. Those are numbers the likes we've never seen before. And in the US, we have had 398 million doses as of today given. And yes, as my colleague said, any vaccine has potential side effects. But I think the onus is on us to determine, well, let's make a choice. Would I rather die of this horrible virus, or would I rather take the small infinitesimal chance that I may have one of the side effects? Yes, your arm's going to hurt for a day or two. Yes, you may get a low-grade fever, but these awful side effects, they are rare, and I will tell you, you have a much greater chance, God forbid, of getting in a car accident or getting in a plane crash, or when you walk across the street from your house to your car getting hit by a vehicle, than you do of having a bad side effect from these vaccines. Now, when these vaccines came out, I heard a lot of, and I felt it myself, boy, that was quick. They rushed that vaccine through. It seemed like it was ready within about 8 or 9 months. And if you didn't do your homework, that's what you thought. And as I always tell my daughters, please do your homework. And so what I did is I did my homework, and I read vigorously, and I found that while, yes, the vaccine came through in about 10 months, we've actually been working with this vaccine for almost 20 years, because the mRNA shell of COVID, many of you may remember back in 2003, we had the SARS virus, right? That ends up looking very similar to the COVID vaccine. And then in 2010, in the Middle East, we had the MERS, or Middle Eastern Respiratory Syndrome. And again, that mRNA shell looks the same. So while in many instances, many people, I think, have vaccine hesitancy for fear that it was pushed through, for fear that the government or the authorities just rushed it through, I want all of you to know that that is absolutely not the case, and we actually have years of experience, just not this widespread. We thought SARS was going to be COVID. Fortunately, it wasn't. We thought MERS was going to be COVID. Fortunately, it wasn't. We ran out of luck with COVID. COVID, as of today, has caused over 700,000 deaths in the United States, has caused about 5 million deaths worldwide. So what I'm saying to all of you out there is, in life, we always have to make choices. And I think the choices you make in many instances define who you are. This is one choice that I think it is absolutely imperative, not only for you as a singular person, but for your families, for your friends, for those around you. Choose wisely, follow the science, look at the data really importantly, and I think when you do that, you'll go ahead and get vaccinated. So my message is, if you've been vaccinated, great. If you haven't been vaccinated, please go ahead and do it. All you'll be doing is good for yourself, for your families. So I want to thank everyone for letting me speak a little, and I'm surely looking forward to what my colleague and friend, Dr. B, has to say. Thank you.
Thank you so much for those encouraging words. Again, I cannot emphasize enough on people understanding why we're doing this evening, why we're taking so much of your time, so that you can go through, what we've heard one too many times for some people and not enough for others. But the importance and behind all of this is get vaccinated. Don't be afraid, speak to your doctors, ask questions, be educated, and that's the best thing you will ever do for yourself. So right now we want to hear as well from Dr. Vivian, and I keep asking to be corrected. Is
Like
it
Queen B?
Queen.
Like Beyonce.
Dr. B?
Yeah,
Thank
Dr.
you.
B.
Thank you for being with us, and please give us some words of encouragement for us to take that step and get our vaccines.
Yeah, thank you so much for having me. And my esteemed colleagues have really said it all. We are a year and a half, almost 2 years into this pandemic, and who would have thought? So I like to approach these COVID talks a little differently, and Dr. Saleh and I have done sort of huddles throughout our hospital and throughout the community. And one of the sort of things that I can bring to the table is to talk about personal experience. And I am going to approach this as a Black woman who is a physician who has minority family members who I've had to walk through the process. I recognize that when I make a decision, or when I made the decision to become vaccinated, that it was not only a decision for myself, but it was a decision for my community, my family, and my friends, because they were going to look at me and many would follow suit. And so the way that I approach these talks is just to talk honestly. I get that there is medical mistrust. I get that there is mistrust in the system and in the government. I get that you don't want to be forced to do anything against your will. I get all of that. So I'm going to start with the first sort of point, which is, as Dr. Saleh and many of my other colleagues have already stated, that this vaccine is safe and it's effective. And when you look at or consider, medications that you may receive or other vaccinations, those should be the two questions. Is it safe and is it effective? And we know now through data, through the months, many people receiving the vaccines, that it is in fact those two things. When I decided to get the vaccine, now this is before there were mandates, so this was a personal decision. I really took time to look at the data. I'm data driven. And again, I recognize that as making that decision to get vaccinated, my mother, my grandmother, would also likely get vaccinated. And so I wanted to make a decision that was not only safe for me, but was safe for my family. The data supports that, the vaccine is doing what it needs to do. The next step is sort of to talk about, okay, so I got the vaccine. I wasn't actually the first to jump on the bandwagon in the medical community. I waited a good month or so, which doesn't sound like a long time, but when we were in the thick of things, a lot of my colleagues were going to go get it. And I said, I need to just see what this is all about. I come from a Black family, we don't just take injections. We have questions. And that was based again on looking at the data. Now, since then, I am very pleased with my decision. I did not suffer many symptoms. I was tired for one night. I had a sore arm that went away, but I will tell you that the anxiety level, and I know a lot of you have anxiety. I know that when we look at the numbers of the psychosocial effects, the psychoclinical effects of COVID-19, it has pushed a lot of people to a place where they never have been, depression, anxiety. It brought my anxiety down. Okay, I was able to then go out with my family. I was able to sort of do things for my mental health. And so that's another consideration to sort of think about. The other point that I want to talk about is I hear, I have family members, and Dr. Saleh knows this, I share this often. I have family members who are conspiracy theorists. And so I've heard every conspiracy theory that you can think of. And I know that we all have heard the conspiracy theories because we're on social media. And unfortunately, this has been politicized. I have addressed the myths that are out there, and I won't attack all of them, but we're certainly happy to answer. You know, if you have a myth or you've heard something and maybe you're not thinking it's a myth, maybe it's a fact, why don't you ask us and we can clarify. From a fertility standpoint, as Dr. Wong stated, you know, this is safe. It's safe and effective as if you're pregnant. You know, there were talks about maybe there's a microchip. There is no microchip, okay, in this vaccine. You know, there are other theories. Please put them out there, because you know, this is a time for us to take a moment and address those for you. And I'm going to tell you honestly, if I don't know, I will say, you know, there may be something to that theory, but because I've looked into it. But ask those questions here in this forum, because we're happy to answer it. And yes, someone put in the chat that, you know, knowledge and well, trusting knowledge is necessary, but we have to be trustworthy. And I recognize that. I recognize that, you know, there have been areas and times recently where we don't have the trust in different systems. And so my hope is that we don't allow that to take other lives. And so that's why I'm here tonight, and I'll stop talking and pass it back over.
Dr. B, you know, how could we not trust what you're telling us? You know, these are facts about Dr. B. She is the section chief of breast surgical oncology in the Department of Surgery for NewYork-Presbyterian Brooklyn Methodist Hospital. A board certified in general surgery, is an active member in numerous professional organizations, including the American College of Surgeons, American Society of Breast Surgeons, Society of Surgical Oncologists, the Society of Black Academic Surgeons. She is committed to community outreach, research, and eliminating breast cancer disparities, and was selected as one of the 40 leaders in minority health by the National Minority Quality Forum for her work, among other recognitions. She's also the founder of Girls Loving Ourselves Successfully, a mentoring program for underrepresented middle and high school girls, and a children's book author. So if we don't trust what you just told us, then I don't know what we're gonna do, because your background is very impressive and you have a lot of knowledge that you're sharing with us. And I'm sure that you've shared that knowledge with so many patients. And I'm glad that you're here with us, because I'm lost for words, because it's very impressive. I appreciate it. Thank you so, so much. We have, let's see who else we had, because we have some gentle folks from other organizations. But before I bring them in, I want to say thank you to Marvin, James, and Sabrina for putting this together, because I know it wasn't easy, and yet they did it. We're here, we're putting this out there. Information is out there now, and I really, really appreciate it. Without you guys, I don't think this would have been possible. So I bow my head to you guys. I really totally appreciate it. We have, let's see, Elise Omates. Come on, please correct me from Spora Health.
No, you got it.
Okay, great. Look at that. From Spora Health, please give us a little bit of insight as to why you're here with us tonight. If you want to speak a little bit about your background, I'm sure we'll all appreciate it. And you know, I'm looking forward to what everybody else has to say.
Sure. Thank you. So good evening. My name is Elise Omates. I'm the head of population health for Spora Health, which is a primary care telemedicine company for people of color. But prior to working at Spora, I was a supervisor for the community engagement specialist in Manhattan for Test and Trace. My team would visit homes of COVID positive patients who were not engaging with contact tracing over the phone. So oftentimes we were present for some of the most stressful times in families' lives, and we were there to offer resources, but to also help them enroll in contact tracing and start to be a part of the system, so we could make sure that folks were sort of within line of what the city needed and were aware of the policies around quarantine. But oftentimes, one of the things that cases struggled with was understanding the instructions around quarantine. And then things would get even murkier when they were getting a negative test result for a rapid test and then a positive test result for a PCR test. And then later on, I moved to the CDC Foundation, where I was working with the healthcare facilities team to manage outbreaks at healthcare facilities in all 5 boroughs. So this was every type of facility, from SUNY downstate to mom and pop dentist offices that you see on your block. I would work with the staff at these facilities to do contact tracing and understand whether there were breaks in the infection prevention protocols. And sometimes we would see that the official policies were actually not aligned with the behavior of staff, which could be even harder to manage in the gray areas like the break room or carpools. So now, I guess I'm trying to tie this to where I'm at now, where I'm working with Spora Health. We've created a health equity and cultural competence training for mid-level and physician primary care providers, which we call the Spora Institute. And one of the topics I spend a significant amount of time lingering on during the training is health literacy. We work to make sure that providers know more than a few techniques for working with patients who may not easily understand their care plan. And that's what ties all 3 of these positions together. So folks have a hard time understanding health needs and healthcare plans, even if they work in healthcare. Health literacy came up in different capacities, but we need to make things accessible for Americans. And for the majority of Americans, it's not. Health literacy is different from sort of functional or everyday literacy, like being able to read a newspaper article and understand what that article means. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and make appropriate health decisions according to what has been provided. So it's also action-based. So when I'm working with providers, I often open up the discussion by asking them how they feel, whether they feel they could identify a person who has low health literacy. And typically quite a few people raise their hands and say, yeah, definitely. But health literacy is distinct because a person can be highly educated. So for example, like an editor at a magazine, but have trouble understanding discharge instructions after surgery, which could even lead to readmission. Right now, as it stands, only 12% of Americans have proficient health literacy skills, which means being able to complete tasks like using a table to calculate an employer's share of healthcare costs for the year. So put another way, nearly 9 in 10 adults have difficulty using everyday health information that is routinely available in healthcare facilities. This also includes things like CVS and healthcare information in your community. So it's not such a simple task to determine who has low health literacy. Knowing that, the NIH and CDC asks that health information be presented to patients at a 6th grade reading level. And low health literacy is really a tough thing to tackle in a pandemic where information is evolving on a daily basis, and nearly everything is described as unprecedented. You'll see patients who are saying things like, first they said don't wear a mask, and now they're saying wear a mask, so why should I trust them when they say get a vaccine? Combine that with a lot of conflicting places where people go to get their health information, and you have vaccine hesitancy as we see it today. So a lot of people look for health information to be easy to understand and accessible. And as one of the other presenters said, it has extra clout if it comes from someone they trust, particularly, friends and family. I think one of the key takeaways that I hope folks walk away with today is understanding that when trying to reach someone who's vaccine hesitant, it's important to reach them with materials that are understood. So I think the main part of this conversation is around, a lot of times folks want to help, their family members who have not gotten a chance, are vaccine hesitant, and say, how do I reach them? How do I help them understand maybe a conspiracy theory, or how do I move them from sort of inertia to getting what they need? And oftentimes these conversations take place in multiple phases. Some folks have, may have read misinformation, and they want to counter it with digestible, valid materials. And each person who's vaccine hesitant has a specific concern. But for those who might be unclear about the safety of the vaccine or waiting because of the newness of the mRNA vaccine, there are resources that can appeal to the emotional concerns while providing sound information. So I wanted to quickly run through for folks who might be wondering about how do you find a good source of health information. If you don't have a doctor, you can call in the family to help build out information. One of the general rules is when you look at a URL ending, anything ending in .gov or .edu generally goes through a fairly rigorous process to actually be published. And they often have public-facing websites that are written specifically to be understood by the vast majority of Americans. So an example of this would be the CDC and the website cdc.gov, or a local favorites, columbia.edu for COVID resources. For URLs that end in .org, these are generally nonprofits or advocacy organizations, and they can be great places for health information, but it's very important to consider whether the organization is actually biased in what they're publishing, and through looking at its mission or potential funding sources. In general, when reading about vaccines, also look to see whether the author cites where they're getting their facts. So if you see them saying, according to the CDC, XYZ, that's an indicator that they're trying to be reliable and valid. Another way to check your resources is to look for redundancy. So if you're reading something that might be a blog post, when you see them stating a fact, if you plug that fact in and you see that the CDC also cited it, or NYP or any of the local sort of reliable organizations, that's an indicator of credibility. And then another indicator is to look at the credentials of the author. So do they match up with what is needed to be an expert in COVID vaccines? Because prior to this, very few people actually qualify for that. It's a small percentage of the population, and you want to be getting information from folks that have devoted their life to this. And then also, when you're trying to reach folks at home, if they speak a language that isn't English, try to find resources in their own language so that you're not creating an additional obstacle. One of the best ways to combat vaccine hesitancy in your community is to guide folks to resources that will help them understand the safety of the vaccine in a voice that they find approachable. But also remember that behavior change often takes place over more than one conversation. So, speaking personally, my sister, she lives in Georgia, and she didn't get the vaccine for months, even though I got mine as soon as I was eligible. But I talked to her slowly about it. First I just said, nothing happened to me when I got the vaccine. I went for a run that same day, and the following day I was minding my own business and at work as usual. And then later, I talked about, how high transmission in Georgia is. And I tried to talk about how, the risk of having to miss work because of being vaccinated is much lower. And then by the time school started, she got a vaccine without anybody pushing her, because she didn't want her daughter to bring home COVID and have to miss work. So being a source of reputable information can be a path for someone making the decision to get vaccinated. But I know that a lot of folks share information about vaccination electronically. So I hope this provides some tools. And thank you, Arlene.
Thank you. I'm so, my head is exploding with so much information right now. I thought I knew it all. But you guys are definitely, wow, I'm lost for words. And Sabrina, that rarely happens, but I appreciate you guys. We also have, is it Rachel or Raquel? Being that I speak two languages, it's one way or the other. Rachel, Raquel, Amar?
I'm going to trick you and say it's both. If you're speaking Spanish, it's Raquel.
Raquel, yes. So fine. I was looking at your bio, very, very impressive. It's you guys, you put me to shame, when I'm looking at your bios. You're currently the senior advisor to the Oath Commissioner. That's an Office of Administrative Trials and Hearings. That's a big, those are big shoes to fill and to make sure that you're out there and that you're on point. It's got to be a lot, with this COVID vaccine and people being so hesitant. It's a long list of things that you're involved in. So hopefully you can, run us through a few of the things or all of the things that you've been doing throughout these past 18 to 19, almost 20 months because of, our not so friendly friend, COVID. So please give us some insight as to what you do.
Okay, thanks, Arlene. I will speak a little bit about what I'm doing to give context on why I joined. First of all, I want to thank you, and I want to thank Sabrina and the Kings County Committee for doing this because it's really needed. I see the participants that are on this, and I'm begging and pleading with you to share this information because, like everyone on the panel has previously said before me, I think almost everyone, it's so important to make that one-on-one connection. And you, all of the viewers that are listening to me right now, have more power than each of us do collectively and individually in reaching places that we have all been trying to reach. So that being said, I work for the city of New York, and I want to share a little bit about the collective city experience. I know Elise spoke a little bit about test and trace. I am the agency's test and trace liaison. They named liaisons in all the city agencies to really help mobilize the city in doing as much as possible to get all hands on deck to really combat COVID in the beginning. Because in the beginning, we realized we obviously didn't have a vaccine. So bravo to how far we have come, right? But the only really tool we had in our toolkit was to test people. So, it's actually good to mention that because we've come a long way. Now we're talking about vaccines and vaccine hesitancy. So I just want to give all the doctors on this panel a round of applause because you have been real heroes. And I respect each and every one of you and probably can go on and on just talking about how great it is what you're doing. But I do want to just briefly mention that we also know that the public is overall, and also doctors, everyone's dealing with pandemic fatigue. So it's really important to really find your own words to express to people that, even though there is pandemic fatigue, we are seeing more people getting vaccinated. So I think that we're breaking through barriers that we didn't break through in the beginning. And I'm going to mention some of those barriers that I think that are helping in terms of resources from the city of New York. One of those is the city has started the Key to NYC vaccination mandate, which requires that everyone that enters indoor settings, most indoor settings, that they get their first vaccine. And so by doing that, it's made people think, well, if I want to go out, if I want to go to an indoor restaurant, if I want to go see a movie, I should get a first shot. And we've seen the rates have increased with that. And another program that I think is really helping, aside from having that indoor vaccine mandate, is we have the New York City Vaccine Referral Program. And essentially it is incentivizing anyone who, and really when I say anyone in the city of New York that has a EIN tax number can participate in this referral program. So you can be a business, you can be a nonprofit, you can be a yeshiva, you can be a house of worship. As long as you have an EIN number, you can apply to refer your folks to get a vaccine. And in doing that, you'll get $100, and so will the person who receives their first vaccine shot. So most of you might know about this, the doctors might know about this, but the more we get the word out, the more it becomes beneficial for really saving people's lives. Because I've heard the doctors use that message before, vaccines save lives, and that's really what this comes down to. Another resource that I want to mention for any people on the call that are business owners or on the webinar, that are business owners or friends with business owners that are dealing with maybe some tension with their businesses and asking for vaccine proof, that we did at the Office of Administrative Trials and Hearings come up with a webinar to help with techniques to kind of counter some of that escalation with people who might be upset when they have to do that. One of the doctors mentioned there's a lot of mistrust of government. So we know that people aren't happy with government right now, and we're trying to do things to kind of counteract that. So I'll provide a link to that information, but I did want everyone to generally be aware of that resource. Other than that, somebody else mentioned some trustworthy sites, and misinformation is an overall theme that all the doctors went into, and I'm glad that they spoke about that. If anyone doesn't feel comfortable with doing the facts and trying to memorize this webinar, I do have frequently asked questions that I can share with Sabrina from the City of New York and from the Department of Health, because the last thing we want to do is get the misinformation going. We want to stop it in its tracks. So I'm happy to share that, and we can send that to all the registrants after this, and I can also put some information into the chat. But other than that, I wanted to just quickly also mention that I've gone all over the city with my coworkers, and what we did is we integrated information that is such like palm cards and information that I'm like holding up about protecting yourself and those around you. If you can get like exposure notifications, because we know that the city's back in business. So we've been giving out information like that to the public, and I have a wealth of resources that I can provide to the county committee, Sabrina, whoever needs it, to share that information with organizations. So I just wanted to quickly mention that our borough president in Brooklyn has done a lot of work acknowledging COVID heroes. I was very fortunate to be one of them, along with Dr. Fauci. But my point in saying that is it really does take the whole borough to be involved. It takes the whole city. So I'm going to end on that note, and I'll enter some information into the chat. But again, I want to thank the doctors for their time and really appreciate being on this panel.
Thank you. Thank you. I can't say enough. All these words that you guys are putting in our ears, and hopefully a lot of us will keep that information in our heads and use it to make sure that our loved ones, first and most, are taken care of. I keep saying, the life you save can be your own, and then eventually that of your family members. So, hopefully everyone is really thinking about these, the conversations that we're having. And it's, it's unbelievable how, you guys have really taken time off your busy schedule to be here with us. I really, really appreciate it. I'm sure that, the district leaders in Brooklyn are, have the same sentiment. I believe Sabrina wants to say a few words. Sabrina?
Yeah, thank you to everybody. Thanks to Rachel who came on a little bit at the last minute, but still here. And it looks like you're still in your office, as are many of us this evening. So special thanks to everybody who stayed late. I just want to give Marvin Zipperin a chance to speak. Marvin is a member of our county committee, a longtime Brooklynite, and has been published in multiple journals, including recently in the New York Times. But most importantly, Marvin really came up with the idea to do this, and I think it's an excellent one. There are very few political parties or organizations like us that have really thought to mobilize a body this large in an effort to vaccinate their constituencies. And I think we're all well positioned as district leaders, as county committee members, as poll workers, as the people that engage with voters and their neighbors as they represent their block every day. So to Marvin, a big thanks. I think it's a great idea, and I'll hand the floor to you.
Thank you. And also I want to say thank you to Eleni and to Rachel, as well as Sabrina, who made this possible. And Eleni was working on putting this together at a time when she was also going through some family emergencies, but was on the phone from a hospital talking with us. And I think that epitomizes everybody who's been involved in this, including people in the audience who are doing work as county committee members and district leaders and to help other people. And so my formal training is as an historian. And one of the things that I particularly see is the times that we've gone through, which have been so divisive, and where basic public health concepts that we thought we understood in the 18th century have become political footballs. It's heartening to see such dedication, not just brilliant expertise. I think each person that spoke was incredible, but equally passionate, and the combination is overwhelming. And one of the other things that spurred me to try to get more people working on reaching people who are vaccine hesitant is I had the privilege when many years ago to meet a young graduate student, young Black graduate student who was working for the National Endowment for the Humanities when I was running a national education program. And he was doing his dissertation on the infamous Tuskegee experiments. And that has made a lasting impression on me in terms of understanding a bit more, because I'm not in that place, but a bit more of understanding why what seems like it should be obvious isn't obvious to everyone, and unfortunately to some of the people who are at most risk and most vulnerable. So I can't say enough about how spectacular I think you folks are, and I think also a person who isn't here at the moment, Rodney's Bichette, who's I never get which is her title. It's the head of the Brooklyn Democratic Committee, who's also been deeply involved in the tragedies befalling Haiti. She clearly made this possible by going ahead and having her team deeply involved in this. And I also have the privilege of being on the Brooklyn Methodist Community Advisory Board, and got to hear some of the outstanding physicians that you've heard before, and knew what a dynamite combination that would be. So if none of you ever kill anybody and there's a heaven, you go up without any waiting list. Thank you so much.
Thank you so much, Marvin. Now that our technology team is on board, I just want to play the clip from a few of our district leaders. It is less than 2 minutes long, so we'll hear from them. They represent a broad section of Brooklyn, and then we'll move right on to the Q&A. So thanks for staying with us.
Hi, I'm Brad Reed, male district leader of the 41st Assembly District in Brooklyn. For the past year and a half, whenever people ask how I'm doing, I say I have my health, my family has their health, and that's all that matters. Life is hard enough. Making ends meet, dealing with regular health struggles. You don't need more. I don't need more. None of us need more. Protect yourself, protect your family. There's a vaccine shot waiting for you right now. Take it.
Hello, I'm Ari Kagan, Democratic District Leader in the 45th Assembly District. Today I want to talk to you about vaccination. In January of 2021, myself and my wife, we were tested positive for COVID. It took us several weeks to overcome this terrible disease. And in July of this year, my wife, myself, my 17-year-old daughter, and my 29-year-old son, all of us decided to get vaccinated because we wanted to do our part. We wanted to help ourselves and our country Today, vaccines are available everywhere. It's easy, it's free, and each one of us can do our part. Please help us to win this war. Be healthy and have a blessed day.
I could not wait to get my 2 shots in arm. As the ambulance sirens increased in frequency, so did the COVID cases. I knew we had to follow the science. This virus is not about any single person. It's about our communities. This is why I shared on social media each time I got my shot and celebrated when others shared the same.
Okay, thank you so much, everyone. Now we can move on to the Q&A section, and I already saw a few questions dropped into the chat, so I want to go ahead and see. I think we can start with Maeve Shakespeare. She dropped a question in at 7:40 p.m. that said, I had 2 women tell me they noticed a change in their menstrual cycle after taking the vaccine. What do you say to childbearing women who are reluctant to take the vaccine because of this possible side effect?
I'm happy to take part of that, and if some of the other physicians want to weigh in. So first of all, I think it's important that we recognize that when you're vaccinating so many people at once, it's really important to separate out what you're just seeing in the general population from an effect from the vaccine. So there have been some complaints or some concerns that the vaccine has changed menstrual cycles. Either they become heavier or people have missed them. And this is under study. So they are studying this to see if there is a link between the vaccines and a change in the menstrual cycle. But I think it's a complex question because we know that stress, infection, a lot of things can change menstrual cycles, and COVID itself. And we are in the midst of one of the most stressful situations that I think anyone has faced in 100 years. So I think that's why there is active study on this. But I want to separate out what we are looking into around menstruation with fertility. So there have been studies looking at animal models as well as just looking at the general population and seeing how many children are being born. There were also studies of pregnancy and the COVID vaccines, and there have been no links at all to any loss of fertility, both in women and in men. So I think, there are, I think they actually just put like a 1.6 or $2 million towards the study of potential link between menstruation and vaccines. But to date, there's been no link then between the vaccines and fertility. So I think what we're trying to understand is this just something that we're seeing in women because we are in the midst of an incredibly stressful situation because people are actually, getting COVID, and because we are looking at millions upon millions of people at once who are vaccinated. So we're not entirely sure yet if there is a link or not. But I think it's very important to then say, we're studying it, but we do not see any effects on fertility, and that has been studied.
Thank you for that answer. We have a district leader in the audience, Arelis Martinez, who has her hand up, so I'm going to allow her into the panel. Arelis, can you hear us? Maybe we lost Arelis. Arlene, let me know if you see her come back to the panel. I wanted to read a question that was already answered in the Q&A for those members of the audience that can't see it, but we had someone, Geneva asks, she said she tested positive for COVID, but had no symptoms, no cough, and no fever. Is it true that there's immunity to COVID? And Dr. Saleh, do you want to speak on that, or should I just read your answer? I think Dr. Saleh is muted.
Sorry, there we go. Sorry about that. So that was a good question. And yes, if you either had COVID, the disease, and were sick, or you just tested positive and you didn't have symptoms, you may indeed have some immunity. But what we have found is that that immunity is variable. Some people may keep it for a month, some people for 6 months, some people for 3 months. It is variable and unpredictable. And by the way, the antibody titers are not really exactly the only marker of your immunity to COVID. There are some other markers. But one thing we know for sure is that when you get the vaccine, that immunity is definitely more consistent, though that immunity lasts longer. And so whether or not you had COVID or not, we are recommending the vaccine. And finally, especially for people who may have had it a year ago or even 6 months ago, that was not a Delta variant. Now in the US, about 99% of cases are Delta. It's essentially all Delta now. And a year ago, or maybe even 8 months ago, there was no Delta. So the vaccine now still offers protection against Delta, whereas your immunity from a year ago offered none whatsoever. I don't know if any of the other members would like to chime in.
I agree. I agree with your statement.
Thank you. That's very comforting.
Thank you all. We have about 5 more minutes, so I just want to let everyone know that we gave people an opportunity to submit questions in advance, and we did get a resounding feedback from our list of people. So I'm going to go through some of these questions and hope it's not too redundant with what we already talked about. For those who are fully vaccinated, does the Delta variant pose a risk? That's the whole question. If somebody wants to take a stab at it, go right ahead. The question is, for those who are fully vaccinated, does the Delta variant pose a risk?
So I think that, if you want to say, can you still get the Delta variant if you're vaccinated? The answer is yes. That's what we are seeing. That's what breakthrough infections is driven by the Delta variant. It's the reason why booster shots for Pfizer have been authorized. And it's the reason why we're still pushing everyone to get vaccinated, because we're really still trying to decrease the circulating amount of virus in the community. What we do see, though, is that those that, and I think these were slides that I think Dr. Wong, you actually shared this already, that those that are vaccinated that develop breakthrough infections, the rate of hospitalization and death is extremely low. So in fact, an overwhelming majority of all of the hospitalized patients with COVID-19 with the Delta variant are unvaccinated. So, we can't say that there is no risk. We can't ever say that the risk is zero, but the risk is very low when you are fully vaccinated. But it is still possible to contract the Delta variant, even if you are fully vaccinated.
I'm muted. Getting the hang of this after 2 years. We have another individual who said they have a family member who has severe bad allergies. Should that member of the family take this vaccine?
Yes.
The answer, but let's let a doctor.
Yes. Yes, as I believe Dr. Wong mentioned earlier, lots of allergies people may have to cats, dogs, foods, etc. Those have absolutely nothing to do with allergy to the vaccine. And as a matter of fact, people who have had reactions perhaps even to the flu vaccine or the pneumonia vaccine, there is no interaction with the COVID vaccine. So allergies absolutely do not preclude someone from getting the vaccine.
Okay, great. We have a good question here. How often should we be getting a COVID test, even if we're fully vaccinated?
Never.
Agree, and only if you're symptomatic.
Symptoms. I also, well, the one caveat to that is it's definitely dictated by wherever you work. So school systems, jobs, they may have requirements for frequent testing, which supersede what we would say here. But then generally the recommendation is always with symptoms. So if you develop symptoms, then you would get tested. There are also, if you've been in very close contact with someone who has COVID-19, there are some recommendations for when you can test if you don't want to complete the full quarantine. But generally, I think everyone here has already very much agreed that symptoms drive testing.
I raise my hand on this one because I'm one of those paranoid people that if I could get tested every day, I would. But with what I do on a daily basis, I have to be afraid. So I just, I go in and I get swabbed and, I walk out with a little uncomfortable nose and then I get over it. But I overdo it sometimes. But that goes back to, the reason why I ended up with COVID. Not that I was not taking care of myself, and this is just recent in April. So I'm still suffering from a lot of side effects. I didn't know I was COVID positive, but because I work at a healthcare facility, I had some symptoms that looked like an allergy problem, which I have allergies. And I kept saying, no, it's not going to happen to me. But the person that exposed me to it was positive on that particular day that I saw her. So I went into this quarantine mode because I have an 81-year-old mother, as Marvin, kind of mentioned earlier. And that was my main concern. So again, it goes back to concerning yourself over your loved ones. If not for yourself, then do it for your loved ones. So I took care of myself. I had one slip up. I ended up not COVID positive. The testing never came out positive, and I'm afraid to say it, but it's the truth. So that's one of the reasons why you have to be extra careful. But I ended up with COVID-19 pneumonia. So that was a bigger deal than just being positive. And I'm still dealing with the side effects, lung issues, headaches, imbalance, vertigo, if you want to call it vertigo, sharp pains in my brain. It's, my appetite has decreased. There's so many different things that come after you being COVID positive that nobody really understands. So why go through that? Why experience it yourself if you're hearing it from the experts and you're hearing it from people that have gone through it, that are here today to talk about it? So my family says, why are you going to tell everybody what you went through? Well, it's my responsibility to let people know that it is real. And these are the consequences after we've had COVID. I don't know if I'll ever be normal, but I'm trying to be as normal as possible in my regular life, because there's so many things that we want to do that sometimes after COVID, it kind of gets in the way. Your health is not the same. So preventing your health from deteriorating, why not just go ahead and listen to the doctors, ask your questions, educate yourself, and get your vaccine. If I had done the vaccine when I should have, I would not have gone through exactly what I went through. I didn't, but it was a lesson for those around me. So my getting sick taught 6 other people to do what they're supposed to do. So it went from a 17-year-old to an 81-year-old for all of them to go in at the same time and get their vaccine. But I was already sick and they knew that. So it was a reality check for them. They went and did it. I'm glad that they did it. So if they do end up with COVID, I pray that it won't be as bad as it was for me. At least it won't be life-threatening. So that's my personal message, because it is important that everyone knows that, yes, we also go through the same thing that everybody else goes through. Yeah, we're elected officials, we're doctors, and, but we also go through what everyone else goes through. I was in a healthcare facility throughout the pandemic, and I didn't get sick. One slip up and got sick. So I appreciate what you guys have been doing, the doctors. I got to thank NewYork-Presbyterian Hospital for, coming together with us to put in this forum. It's very important that people understand that we are on everybody's side, regardless of who you are, what you believe in. If you believe in being healthy, then there are steps that you must take in order to maintain a healthy life. And right now, we're talking about COVID-19 vaccine. That is the one thing that needs to be done. Vaccinate. And, we pray and hope that, from here on out, things start to get better and we could start living our normal lives as normal as possible. And we trust our doctors and higher authorities to lead us in a way that is, healthy, because it's about being healthy in every way that we can possibly think. So I appreciate you all for being with us tonight. I can't thank you guys enough. It's really, an honor. And again, NewYork-Presbyterian Hospital, thank you for, giving us staff time to be with us and explain what we're all afraid of. We can't be afraid of the unknown. So we must know about it so we could end our fear. So I thank you guys. If you guys want to say something else, Sabrina, is there another important question out there?
No more important questions. I want to give Rachel Amar a chance to speak. I think she has her hand up. Is that?
I will never challenge any of these doctors, but I just wanted to add, there was a good question about when to get tested, and the city is also, the Department of Health is also making recommendations that 3 to 5 days after having close contact with someone who had COVID-19, and this is recommendation for people who are fully vaccinated. And they're also recommending 3 to 5 days following international travel. So if any of the doctors want to add, they're more than welcome. But I just wanted to say, somebody had questions about boosters, and I think it's worth it for one of the doctors to address that question about boosters.
You're correct about the testing. That was what I was alluding to, is that if you had a close contact, we still do recommend testing.
Great.
Very quickly, the difference between third doses and boosters. I think this is an important question. So third doses, which is different than a booster. Third doses are authorized for patients or people that have underlying immune system problems, meaning their immune system isn't as robust as someone else. So the thinking is that you need an additional dose of Moderna or Pfizer to get you up to the same level that someone else could have gotten to with 2 doses. That's a third dose. So that's different than from a booster shot. Boosters are for those, so this is only for Pfizer now that we're talking about. Over time, we have seen, as we've all been talking about throughout this whole session, the Delta variant is transmissible. It has mutated since the original Alpha variant that we saw in March of last year. So we saw that with Pfizer, the efficacy, although still very good, was losing a little bit of its strength against Delta. So Pfizer studied this and they recommended booster shots, not for everyone, not yet, but booster shots for specific individuals, those that are healthcare providers, so in close contact with people with COVID, those that have underlying medical conditions that put them at increased risk of getting very sick from getting infected. So booster shots are currently authorized for Pfizer only and for specific people. Right now, Johnson & Johnson is doing something similar, looking at a booster shot for Johnson & Johnson. And so they're applying to see if that will be authorized. And, I welcome, Dr. Wong or Dr. Saleh to comment on Moderna. Moderna currently is not thought to require a booster, although it may. But right now we're really looking at booster shots only for Pfizer and probably Johnson & Johnson in the coming months.
I would just like to comment that you beat me to your booster. You're getting yours tomorrow. I couldn't get mine till Monday. So another victory for you. Well done.
Thank you. The minute they were authorized, I was like, oh, I should make my appointment.
I was on the Connect app.
I was about to wrap, but I see a pretty good question in the chat, so I'll allow this to be our last question of the evening. Someone is asking if they didn't get their second shot or COVID vaccine within the recommended time, what should they do?
I can answer that. So right now, the recommendation is they can just play catch up. They do not have to restart the series. Just get the second shot as soon as they can. Whether it's Pfizer or Moderna, it doesn't matter.
And then would they be on the regular schedule for the booster?
Correct.
Okay.
Yes. So, right now, as Julia has said, that the booster vaccine is only approved for the Pfizer vaccine. We do not yet know about Moderna or Johnson & Johnson, so we're waiting on the news about that. But for right now, as of this moment, the booster is for Pfizer only. And again, it's very, very important for us to all understand the third shot. As Julia had mentioned, there's a subtle difference to it. Although it is technically a third shot, there are people who are have underlying medical conditions, say cancer, or they're transplant patients, or if they have been on immunosuppressives, let's say prednisone for a long time, those are the patients who will need the third shot. So no matter if it was the Pfizer or Moderna, it's recommended for them to receive the third shot.
Okay, thank you, Dr. Wong.
Thank you.
I think that wraps up our panel for this evening. A huge thank you to everyone who participated. I also want to mention that many of our guests this evening have offered graciously to provide some resources. I know that NYP mentioned that they have information translated into different languages. And if you're a district leader or a county committee member who's on this call right now, and you think that having pamphlets or more information would benefit your constituency, please reach out to me or to us, and we will make sure we put you in touch with the right people to get you those resources. And I'll be following up with a newsletter, including some of the resources that were shared in the chat and with the panel this evening. So thank you all. Have a good night.
Thank you.
Thank you, everyone. Thank
Thank
you.
you.
Have a
Good
good night.
night.
Stay safe.
Bye.
Thank you.
Be well.